Welcome to the Psychology and Physical Training channel. Introduction to Psychopathology Behavioral Therapies. 1. Ever wondered how we can alter harmful or unhelpful behaviors using psychological methods? Welcome to the world of Psychopathology Behavioral Therapies. This intriguing field is all about understanding and changing behaviors that can cause distress or impairment in an individual's life. It's a vital part of psychology, used to help people overcome phobias, anxiety disorders, and other mental health issues. Today, we'll be delving into 4 distinct therapy methods. First, we have behavioral modification, a technique aimed to help replace undesirable behaviors with healthier ones. Then there's counter-conditioning, which utilizes the principles of classical conditioning to change how a person reacts to certain stimuli. Systematic desensitization is up next, a method often used to treat phobias and anxiety disorders. Lastly, we'll explore reinforcement responsive steps, a strategy that uses positive reinforcement to encourage desired behaviors. So, are you ready to unravel the fascinating intricacies of these therapies? Let us dive in deeper to understand these intriguing therapy methods. Behavioral modification. First on our list is behavioral modification, a therapy method that believes in changing maladaptive behaviors by using learning principles. So how does behavioral modification work? Picture a staircase, each step representing a new skill or an altered behavior. The individual climbs the stairs slowly but surely, changing their behaviors one step at a time. This process is not a quick fix, but rather a journey of gradual and constant change. Behavioral modification begins with the identification of the problematic behavior. This could be anything from a harmless habit to a destructive addiction. The therapist and the individual work together to understand the causes and triggers of this behavior. Next comes the goal-setting stage. Here, the individual is encouraged to visualize their life without the problematic behavior. The therapist helps them set realistic and achievable goals. They agree on a new behavior to replace the old one, paving the way for the next step, learning. In the learning phase, the individual is taught new behaviors and ways to react to the triggers that once led to the problematic behavior. This is done using various techniques and exercises. The individual might role-play situations or practice mindfulness exercises to help resist the urge of falling back into old patterns. Now, the real test begins. The individual starts applying these newly learned behaviors in their day-to-day life. They might stumble, they might falter, but with every fall they learn to rise stronger and more determined. The final step is reinforcement. The individual is praised and rewarded for their progress. This positive reinforcement motivates them to keep going, to keep climbing the staircase one step at a time. Behavioral modification has proved to be effective in treating a wide range of psychological conditions, from anxiety and phobias to addiction and eating disorders. It's a therapy method grounded in the belief that all behaviors are learned, and therefore, can be unlearned. Behavioral modification, a fascinating method, isn't it? But wait until we explore the next one. Counter-conditioning. Moving on to counter-conditioning, a therapy that aims to replace a problematic response with a more adaptive one. Counter-conditioning isn't just a fancy term thrown around in the world of psychology. It's a practical tool that can help people change their unwanted behaviors. So, how does it work? In essence, counter-conditioning is a process of retraining. It involves teaching an individual or even an animal to respond differently to a stimulus that previously triggered an undesirable behavior. Imagine you're scared of spiders. Just the sight of one sends you running in the opposite direction. That's your conditioned response. But through counter-conditioning, you could learn to replace that fear with a more positive or neutral reaction. The first step of counter-conditioning is identifying the unwanted behavior and the stimulus that triggers it. In our example, the fear is the behavior, and the spider is the stimulus. Next, we introduce a new, more desirable response. Maybe it's calmness or indifference. To achieve this, therapists often use techniques like relaxation exercises or guided imagery. The idea is to associate the stimulus, the spider, with this new response. Over time, with consistent practice and exposure, you might find yourself reacting less and less to spiders. Instead of fear, you feel calm. That's counter-conditioning in action. Counter-conditioning is not a one-size-fits-all kind of therapy. It's often tailored to the individual's needs and circumstances. It's used in a variety of settings, from helping people overcome phobias and addictions, to training pets and animals. While it may not be a quick fix, research has shown that counter-conditioning can be highly effective. It's not about suppressing the undesirable behavior, but replacing it. It's about changing the narrative. giving people the tools to respond differently to the world around them. In essence, counterconditioning is a journey of change. It's about taking steps, however small, towards a healthier, happier you. It's about learning to respond, not react. Counterconditioning, an interesting approach to change behavior. Now let's move on to our next therapy method. Systematic desensitization. Next up is systematic desensitization, a therapy method that gradually reduces fear and anxiety responses. Imagine you're scared of spiders. Every time you see one, your heart races, you start sweating, and you just can't stay calm. This is where systematic desensitization comes into play. It's a type of behavioral therapy developed by psychologist Joseph Wolpe in the 1950s. This technique helps individuals to overcome phobias and other anxiety disorders. Systematic desensitization is a three-step process. First, the relaxation training. Here, the individual is taught relaxation techniques to combat the anxiety response. This could be deep breathing, progressive muscle relaxation, or even guided imagery. The goal is to help the individual achieve a relaxed state of mind that can counteract the anxiety. Next, we have the fear hierarchy. In this step, the individual, together with the therapist, makes a list of fear-inducing situations related to the phobia, starting from the least scary to the most terrifying. For our spider-fearing friend, this list might start with thinking about a spider, then looking at a picture of a spider, and finally, holding a spider. The last step is gradual exposure. Here, the individual confronts the fear-inducing situations in the hierarchy while using the relaxation techniques learned in step 1. The exposure starts with the least anxiety-provoking situation and gradually moves up the list as the individual becomes comfortable with each stage. Now you might be asking, does it really work? Well, according to multiple studies, systematic desensitization has shown significant effectiveness in treating specific phobias, social anxiety, and even post-traumatic stress disorder. It's a brilliant method that combines relaxation and confrontation, enabling individuals to gradually unlearn their fear responses. Systematic desensitization, a great tool to tackle fear and anxiety, but we're not done yet. Let's proceed to our final method. Reinforcement responsive steps. Last but not least, we have reinforcement responsive steps, a therapy method that uses rewards to encourage positive behavior. This approach, rooted in the principles of operant conditioning, offers a practical and effective technique to modify behavior. Let's dive into the process. Reinforcement responsive steps begins by identifying the desired behavior. This could be anything from a child cleaning their room to an adult managing their time effectively. Once the behavior is defined, the next step is to establish a system of rewards. These rewards, or reinforcements, are given each time the person exhibits the desired behavior. The rewards can be anything that motivates the individual. For a child, it might be extra playtime. For an adult, it could be a leisurely activity or a treat. The key here is that the reward should be something that the person values and desires. The more appealing the reward, the more likely the individual will be motivated to exhibit the desired behavior. Now, it's important to remember that not all reinforcements have to be tangible. Praise, encouragement, or even a simple smile can serve as powerful reinforcements. These non-material reinforcements help to build self-esteem and confidence, fostering a sense of accomplishment and satisfaction. As the individual continues to exhibit the desired behavior, they begin to associate it with positive outcomes. This association strengthens over time, leading to a change in behavior. It's a process of teaching and learning, where the individual learns to associate the desired behavior with positive reinforcements. The applications of reinforcement responsive steps are vast. It is used in various settings, from classrooms to therapy rooms, from homes to workplaces. Its effectiveness lies in its simplicity and its focus on positive reinforcement, making it an appealing option for behavioral change. In conclusion, reinforcement responsive steps is more than just a method of behavior modification. It's a reflection of a basic human trait, the desire for positive reinforcement. When we reward good behavior, we encourage more of it. It's a simple yet powerful principle that can foster significant change in behavior. Reinforcement responsive steps, a therapy that proves how rewarding good behavior can bring about change. Conclusion. We've now explored 4 intriguing psychopathology behavioral therapies. Let's recap. Behavioral modification is all about changing behaviors through various techniques like positive reinforcement or punishment. It's like tweaking the dials on a radio to find the perfect frequency. Then we dived into counter-conditioning, a process of retraining the brain to respond differently to stimuli that previously triggered unwanted behaviors. Think of it as reprogramming a computer. We also examined systematic desensitization, a therapy designed to reduce fear and anxiety. It's akin to slowly dipping your toes into a pool before diving in. Finally, we touched on reinforcement responsive steps, a method that uses rewards or consequences to shape behavior. It's like a game of chess, where every move can lead to a win or a loss. These therapies are not just abstract concepts. They can be applied in various contexts, from school settings to clinical therapy, and even in our daily lives. Remember, these therapies are powerful tools to bring about behavioral change. Until next time, keep exploring the fascinating world of psychology. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thank you for watching.